The response to AILA is led by the Government of West Bengal and is supported by UNICEF through its partners Ramakrishna Mission Loko Shiksha Parishad along with 6 other NGO partners and 12 cluster organizations moved in pre-positioned emergency supplies that include 112,000 water jerry cans, 1.75 million water purification tablets, 3,134 family hygiene kits, 520,000 sachets of oral rehydration salt, 14,070 tarpaulins and 200,000 flood emergency booklets. UNICEF is continuing its key interventions among the most vulnerable populations in the most affected blocks of Sandesh Khali 1, Sandesh Khali 2 and Hingalganj block of North 24 Parganas and Gusaba and Pathur Pratima block of South 24 Parganas. The focus is essentially on life-saving interventions for approximately 50,000 most affected families. To control the potential large-scale outbreak of diarrheal diseases in the most affected areas, UNICEF, along with National Rural Health Mission and National Institute of Cholera and Enteric Diseases, is partnering with Calcutta Medical College and Neel Ratan Sarkar Medical College, Kolkata. Junior doctors have been mobilized for demonstration of protocol guidelines on acute diarrheal diseases, control and disinfection in health facilities. 900 medical and paramedical staff and frontline workers were trained on diarrhea management. UNICEF has also opened 20 ORT corners in health centers at community level to provide oral rehydration therapy to people suffering from diarrhea. Through these corners, ORS, halazone tablets, bleaching solution and IEC materials are distributed. Demonstration is being given on ORS preparation and people are oriented on diarrhea prevention. Bleaching stock solution for household level water purification is being prepared by NGO partners and distributed to families. Measles vaccination and vitamin A supplement campaign for children between 6 months and 5 years is running to prevent measles outbreak. This campaign aims to cover around 160,000 children in 7 blocks. On the nutrition front, UNICEF has partnered with 6 local NGO partners for the protection and promotion of breastfeeding, complementary feeding, and also monitoring the nutritional status of young children, and is presently conducting a nutrition assessment. The severe acute malnourished children are being referred to the nutritional rehabilitation centers. In some areas, the education system has completely collapsed as a result of the flooding in the wake of the cyclone. However, the systems are now showing signs of revival. 187 school-in-a-box kits have been delivered and another 510 kits are to be delivered to approximately 56,000 of the most affected children in the focus districts. 300 sports kits are also being procured by UNICEF to promote psychosocial recuperation among children in the schools. 60 tents are being provisioned to facilitate alternative learning spaces in cases of demolished SSKs. UNICEF's efforts to advocate for the reopening of the schools as early as possible have been appreciated by the government directorates Sarva Shiksha Mission and Shishu Shiksha Kendra Mission. For child protection, UNICEF is providing psychosocial support to the affected children and creating awareness on unsafe migration of children. UNICEF provided chemicals for water testing and for disinfecting tube wells to the Public Health Engineering Department for the affected districts. To strengthen inundated tube well disinfection, over 100 PHED staff members have been trained in North 24 and South 24 Parganas. It has imparted training to village community on repairing tube wells and filling up monitoring forms. Training on community-based disaster risk reduction or CBDRR has been a part of the capacity building. The biggest challenge is the difficulty to access the affected places. Some of the areas are so isolated that the only means of access is boats, which means the entire affected population is still inadequately reached. The saline water that has entered the agricultural fields would not allow any crops to grow for the next few seasons. Arising from food insecurity is the challenge of unsafe migration to different parts of Bengal and India. Outbreak of diarrhea and other enteric diseases. Low attendance of children in the primary schools. AILA has been an unprecedented cyclone since 1942. This left the people virtually unprepared for the assault. One of the main reasons for such widespread damage is the breach of hundreds of kilometers of river embankment. In spite of such unparalleled natural disaster, the national and the state government have been quick in its response. The NGOs took the shortest reaction time to respond, and above all, the local people stood beside their fellow humans to provide support. The devastation is massive, and the support in comparison is inadequate. We need to ensure that support continues to the people and avenues are open to extend this support to as many more people as possible. It is true, we were powerless in the face of AILA, but together we all are powerful enough to help people stand back to its feet with dignity.